Bismillahirrahmanirrahim. Assalamu alaikum. My name is Waseem Anwar from Lahore, Pakistan. And with me, my beautiful co-host, Verona Willis-Brown. So, hello, Verona, how are you?
I am doing great. Thank you so much, Waseem, for having me again to co-host with you. It's always a pleasure to serve with you. Thank you. How are you?
Yeah, I'm good. I'm good. And we are yet again back with an exciting and informative series of interviews, starting with one of the most dynamic men in his field. We lucky enough having a specialist from medical field today. I am going to introduce you with you very prominent and competent and skillful doctor. He is also associate professor in University of Sargodha Medical College and similarly the others. A man who possesses ample knowledge and carry a vision of bringing a change in the lives of people. We are lucky enough to get his learning and experiences. He is none other than Dr. Muhammad Arshad. Hello, Dr. Arshad. How are you? Assalamu alaikum.
I'm fine. I'm fine. Alhamdulillah. Walaikum assalam. How are you doing, Mr. Waseem?
I'm fine. I'm fine. Thank you very much. You gave me your precious time. I know you are very busy and you are doing multiple tasks. So thank you very much. You are here.
You're welcome. You're welcome.
So
Thank you for giving me an opportunity to interact with such a great people.
Thank you. Thank you very much. So we start this session. So my first question is, can you please introduce yourself and tell us about your background and experience as a pediatrician?
I'm Dr. Muhammad Arshad. I'm an associate professor and in Sargodha Medical College, and I am working here as a consultant pediatrician, and I have experience of 17 years as a pediatrician in the field of pediatrics, and I am working in pediatrics for last 23 years. I am a trainer and mentor for the many training programs in my country, including fellowship programs, MD programs, and diploma programs. I'm an examiner and evaluator for the undergraduate and the postgraduate exams in Pakistan. I am also a member of different evaluation forums for the research work done in my field, and I am also a clinician in government sector and also doing my work in private sector as well. My areas of interest in pediatrics are in neonatology and cardiology. Is it okay, Waseem?
Mashallah, mashallah, very good and excellent. And Verona ma'am, and we are getting a competent and competent and excellent persons in Onpassive, and we are expanding in every field, everywhere. Thank you very much for this brief introduction. And my next question is, what motivated you to specialize in pediatric and why did you choose to pursue this career in Pakistan?
Actually, these are the two questions. The question one is that in Pakistan, we are still having higher infant mortality rate and neonatal mortality rate, even in the Asia and in as compared to the developed world, our rate of mortality is higher. And there are many reasons behind this. So I wanted to serve my country for the health of the children. And why I chose this, honestly speaking, I love with the children and I want to be a healer for the children so that I can help these small children regarding their health issues.
That is excellent. Waseem, you're muted.
Sorry. Excellent, Dr. Arshad. Could you please describe the most common health issues or diseases you encounter in the pediatric population in Pakistan?
As like the third world countries and the developing countries, the problems of the Pakistan are same in Southeast Asia and sub-Saharan countries, and even the problems are very much similar to the our other parts of the world, just with exemptions of the few developed world countries The pediatric is facing the problem of diarrhea and the respiratory tract infections in children, and these are very oftenly seen in my clinical practice. But unfortunate component of this is that this diarrhea and malnutrition, this diarrhea and respiratory infections are not the big deals. They are usually the viral ones and some the bacterial ones. But unfortunately, the malnutrition, the low weight of the children in Pakistan as compared to their other age children is the problem. And that's why when we treat with these undernourished and malnourished children, they get these problems very much serious. Even a minor diarrhea and the minor ailments like respiratory tract infections can become a very serious and lethal diseases in a children who are malnourished, whose weight and the height and the growth is not appropriate. So you can see that we are facing the challenge of growth retarded children and malnutrition in our country. Mr. Waseem, you are again muted.
Sorry. Great. Dr. Arshad, you are doing good. And over to Verona, ma'am.
Excellent. And Dr. Arshad, that is excellent. And I listened very, very closely to your answers. Waseem, those are excellent questions. I listened to you closely, and you mentioned that you've been working in this field for 23 years. 23 years. So you've been a pediatric doctor for 23 years. Now, I want to celebrate you first on that. I want to celebrate you on that, because to be a pediatric
Thank you.
23
Thank
years.
Thank you very much. Thank you.
That's great accomplishment. So I want to ask you, in that same manner, what has been the funniest thing that you have experienced with those children? Because children said the darnest thing. Give me one of the funniest experience you had within 23 years.
Okay, that's a very interesting question. The funniest thing which we oftenly get in the children when they are coming to my clinic and destroying all the components, even the normal children destroying all the things in my room, and always sometimes, and one thing more which I would like to share with you, that in our country, sometimes the babies passing the urine in my room, and sometimes normal newborn babies, and sometimes they do vomit, and sometimes they pass diarrhea in my room, and we enjoy this because this is the normal phenomenon in the children.
And I know for you, because you're passionate about it, and it's something about passion. When we are passionate about it, the minor things that we look as minor, they become just not, right? We look at them like, yeah, because we are so passionate about it. And I could feel the passion in your answers, and I could hear the passion stemming from your heart of how passionate you are about this. And how passionate, I love children, so I love to see when we're investing in our children, because when we invest in our children, it is good because we're thinking about the future. We're thinking directly about the future. Yes.
Any country can develop if they invest on their children, on the health of their children and the education of their children.
Absolutely. Absolutely. So with that said, you said that you're a neurologist and a cardiologist. So those are great. Those are very extended specialists. What put you to go in neurology and cardiology?
Actually, the Pakistan, again, as I'm a doctor in the third world country, and Pakistan is facing a lot of challenges regarding the health of the children. So my passion is cardiac patients, because of unfortunately we are having huge mortality in the neonates, in the newborn babies, in the babies who are less than 28 days of age, and we are having the huge mortality due to the cardiac problems. And sometimes they go undiagnosed, sometimes they go untreated. And so as there are not many more cardiologists in the country, so that's why I chose this field to work for the health of the cardiac patients, the children who are suffering from the heart diseases.
Wow. See, I want to, before I go to a question here, there's something about our heart. You see, when we talk about our heart and we're serving from the heart, which is another message from Onpassive as well. We serving from our heart. And when we serve from our heart, we're serving humanity. We're serving
Thank you.
humanity. So when we get children, where we are attending to children from our heart to serve their heart, we are doing justice to the earth. We are doing justice to the
I
earth.
always look at their heart. I always look at their heart.
Because that is where everything stems from. That's where everything
Yes.
stems from. The good, the bad, the ugly always come from there. So yes, so I like cardiologists because there's a special place for me when it comes to cardiologists.
Thank you.
Excellent.
Thank you.
What is one of the main challenges that you've been having with working in this field?
Working in this field, the basic challenge in Pakistan is that the children with the heart diseases in very oftenly need the surgeries because most of the cardiac problems in the children can't be treated medically. They need the surgeries. And in Pakistan, the cardiac surgeons are very few in number, and our hospitals are very much crowded with the cardiac patients. But the number of the patients and the doctors in the cardiac surgery, there is always disproportionate between these two things.
So in that case, what is it that how do you handle patients in that case?
Honestly speaking, we face a lot of challenges, and sometimes our children can't reach the operation theater, and because of their heart problems, sometimes, not very oftenly, but I would be saying many of the times, they die in their first 2 years of life without getting the surgery done. And sometimes they get the complication of the disease because if the surgery is not done well in time.
Wow. And that's very painful at that time
That's
when you have
That's a
multiple
very
cases
painful
like
for
that.
the doctor, for the family, and that
Yes.
is very, very much challenging for the society.
Yes. Yes. And this is why I like where we are right now in Onpassive, because Onpassive has come. We think of solution, and when we are talking about anything even outside of Onpassive, we're thinking about solution. And you being a pediatric doctor, your job is to think of a solution of how to help your patient. So when we mix and mingle your passion with Onpassive, we are going to create greater solution for the world. For Pakistan, for outside of Pakistan, we are going to create greater solution because solution is the key. Solution is the key.
Yes,
Yeah. If
yes.
we don't have solution, then we don't have a better world.
We are always working for the solution, but still we are facing a lot of issues.
Yeah. But we're going to work together. We are going to work
Yes,
together.
we will, inshallah. Inshallah,
Inshallah.
in being the Muslim, inshallah means with the support of my Almighty Allah.
Yes. Absolutely. Absolutely. Yes. Yes. Thank you so much. Those are great. Great. So we're going to work together. Don't you worry. We're here together because together,
Thank
when we
you.
work together, we will have a better community, not only in Pakistan, but around the world. Around the world. So we're going to go through that together.
Inshallah, inshallah.
Yes, inshallah. Thank you so much.
Thank you.
Verona ma'am,
Any
before you ask the next question, I want to introduce yourself. Dr. Arshad don't know about you, so please.
Oh, wow. To introduce myself, let me say a lot of people know me as a, writer, or a show host, a youth mentor, a blogger, all those good things. I am just simple Verona Willis-Brown from the USA, originally from Jamaica. So when I represent both countries, USA and Jamaica. And I love to serve. I have, my main thing in life is to inspire one person at a time. And when I inspire one person at a time, I know that it will be a ripple effect so I can impact the masses. So that's just a short bio of me. I am not I'm just a servant of God. I am just a humble servant that love to show up and serve. So yes, that's just basically about me.
That's a very good introduction, and I wish you a lot of good things in your future as well. To have more and more feathers in your cap.
Thank you so much. I thank you so much, doctor. Yes, thank you. See, I usually call myself, I'm a doctor, but not a medical doctor. I'm a doctor because of my experience and the knowledge and wisdom that God gave me. So so we are
That's true.
doctors together.
Yes, we are.
Yes, we are doctors together.
Yes.
Yeah. Excellent. So let us go into another question for you. Outside of Pakistan, let's see how we can operate outside of Pakistan, because I know you're in Pakistan, you're serving your people in Pakistan, but have you noticed any notable cases outside of Pakistan that you have contributed to? Really, sometimes when we contribute to things, we contribute physically, but my main thing all the time, when we contribute, we must contribute mentally, right? When we contribute mentally. Have you seen any notable cases outside of Pakistan where you can contribute to?
Honestly speaking, I've not worked too much out of Pakistan as a doctor. I have been in the different parts of the world. I had been in USA many times to attend the international conferences. But honestly speaking, I have not been a part of direct treating as a physician out of the Pakistan. But I have worked in the different parts of the Pakistan because Pakistan is itself a very big country, and I had been having a huge experience of treating different children with the different problems in many parts of the country.
Excellent. So I'm going to ask you my final question. I'm going to go back over to Waseem. But let me ask you, throughout the years, 23 years is a lot. That's an entire lifetime. What development have you seen so far within that 23 years? What improvement have you seen in the medical field?
Yes, in Pakistan, Alhamdulillah, it means all praises to Almighty Allah. In Pakistan, there have been a uh, huge achievements in field of pediatric cardiology, in cardiology of the children and neonatology. We have got uh, uh, so many interventional cardiologists who are doing angiographies and angioplasties and opening the valves of the children. We have been having more pediatric cardiac surgeons, the issue which I was already mentioning. We have reasonably good number of pediatric cardiac surgeons, although still there's a disproportionate between the number of the patients and the number of available cardiac surgeons, but the number of cardiac surgeons have been trained too much. We have got uh, association, or we have got MOUs with the different part of the developed world for training our cardiologists and our cardiac surgeons in this field. So I have seen a lot of things, and our mortality due to heart diseases have decreased, Alhamdulillah. And that's one thing more. The initial issue, which was 30 years back in this country, there was no recognition of these diseases. First, you recognize the disease, then you make a plan for the disease, and then you treat that disease. So honestly speaking, in last 30 years before, we didn't have so many options to recognize these diseases. But now, fortunately, these diseases are being recognized even at very smaller levels, and the physicians and the child doctors, the pediatricians are doing wonderful in recognition of these diseases. Thank you. Thank you.
Excellent. Thank you so much. Absolutely. And I hope, audience, as you listen in, you take note, because that is the main thing about life, that we should have some form of achievement as we go through life. We can't just go through life without some form of solution and some form of development, some form of achievement. And when we work together, especially now that we are in Onpassive, we are going to continue to seek solution and seek development for our children as well as the rest of the world. Dr.
Inshallah.
Arshad, inshallah. Thank you so much. All right, so thank you so much, Dr. Arshad, for those wonderful answers. Like I said, audience, as you listen in, just remember that we are here to build solution. We are here to contribute to the world. We are here to replenish the earth and lift up humanity. So yes, thank you so much. Wait, before I go, I want to ask Dr. Arshad one last question here. Dr. Arshad, how is it that you build a trust between your patient and the family?
How I feel? Sorry?
Yes, how do you build trust between your patient and the family, the entire trust
The
factor.
trust has the trust has its own implications. So is it the same question?
Yes, how do you build trust between, is a relationship, because when you're a doctor, you have to have a relationship between your patient and well as the family. So how do you build a trust between the patient and the family?
Actually, first of all, I am explain them about their disease and the problem, and then I let them know about different solutions, and that solutions may be in the different forms that may be available in the government sector. That sometimes they may be involved in a private sector, which includes insurance of the health authorities and all the other components. So I always built a trust between myself and my patients regarding their treatment components, their questions, their fears, and their obviously their social issues. And obviously, after telling them when they get disturbed that their child is having a heart disease, I have to give them a confidence, and I have to console them psychologically, and I always have need to give them social support as well, and uh, they always need guidance from me. So this is the way I make a trust between my patients and myself.
Thank you. Thank you so very much. You said a key word. There's a key word before I hand over to Waseem. A key word is confidence. So let us take into consideration the key word, confidence.
Confidence is the main thing
Yes.
to treat the patients.
Yes. Yes. Thank you so much. Waseem, go ahead.
In the last, thank you very much, Dr. Arshad, for this brief and good questions. Last question I have from Verona, Willis-Brown. So,
Yes,
because Dr. Muhammad Arshad recently joined this Onpassive and he doesn't know about this organization. So, how Onpassive can improve health department, or you can say how Onpassive will help through its products. So, this is my question, Verona ma'am.
Waseem, thank you very much for asking about the Onpassive. Yes, you are the first one who introduced Onpassive with me, because honestly speaking, I was not well aware of it. So Onpassive can help the people in a many ways. But the first part is obviously, as Miss Verona was also saying, that the first part is always awareness and letting the people know about their problems and letting the people know about their issues. So awareness in the health and and awareness about the different medical problems in the different parts of the world can be the first assignment taken by OPASSIVE. And the second thing, obviously, you can help with different professional personnels by involving them and creating the solutions for the major health problems of the developing world. And obviously, there are certain issues of the developed world as well.
Thank you. Thank you.
That was
so.
excellent.
No more questions?
Yes.
So,
go ahead.
So, Verona ma'am, I asked questions about Onpassive products. So, because Dr. Arshad doesn't know about the products, how we can relate with health department. So, do you have any product in your mind?
Okay, we want to talk about just probably 4 products that we want to, and I want to call them solutions. I want to call them, if you want to call them products, then you call them products, but I want to call them solutions, because that's exactly what we're talking about, is to bring solution. And Dr. Hasha just said, bring awareness to something. When you bring awareness to something, you're going to come with solutions. So I want to call these things solutions. Instead of we calling them products, I want to call them solutions. So solution number 1 is, one of them is O staff. When we talk about O staff is one of those products where, you know, you go to your facility, your medical facility, and when you go to your medical facility, many people come in there and workers, you know, they're workers that come in there, and you want to make sure that when they come in there, they come in there with a mindset to work and work truthfully. But most of the time when you go, sometimes they clock in and then they're not working, or sometimes they don't clock in and then they're working, or they clock in but they left their desk and they go storming away. So when we're talking about old staff is coming with the CC caption, where it literally tell you that you were here. You present yourself, but then it's gonna calculate, okay, but Waseem was not here for the next 20 minutes. Waseem came in, but Waseem left. Now, when we talk about that, we're talking about, okay, you put in at the end of the day that you work 8 hours, but no, you didn't. You work only 3. But then here we have old staff. Old staff is so accurate that it's saying, listen, whether you're in the medical field or not, we are here to let you know that we are very much aware of where you are on the facility, right? So we want to think about
this is
things
human
like this.
resource product, HR product. Basically, this is
Yes, exactly. So it's HR, because when we talk about you're clocking in your time, it goes basically it leaves you and it goes right to HR.
In hospital, you can check and balance through this product. Before, if you are hiring 50 people, you can only hire the this product, or only one man can control everything. So everything will be watched through CCTV. Every work will be watched through CCTV. Even appraisal will be done through this product. No favoritism. No favoritism. Everyone will be punctual. Everyone will be punctual. So
yes,
and royalty program, every employee will get a debit card. If everyone will get a salary from this ATM, the above persons will get royalty. So this is amazing product, and I think no one comparison from this product, and many things integrated with this product. For example, the similar product we have in market, but for example, if someone using this product, if we want to do email, so he will use Gmail. If he want to do meeting, he will use Zoom. If he want to we want to do email marketing, so he will buy a product. So if we want to do payment system, he will connect with PayPal or banking system. But everything integrated with this product. You can connect. There is a connect like Zoom, but better than Zoom, a product, the first upcoming paid product. We have discussed before. We were trying to join. Dr. Arshad, you remember? So, OConnect will integrate it with this O staff. You can call your staff through this OConnect. And there is most important thing. There is a sign language in OConnect. If you have deaf and dumb people, there will be an avatar. The avatar will talk who is speaking, and the language barrier, no language barrier there. Someone is speaking in French, and you can use closed caption in Urdu or whatever your language, or audio. You can hear in your language. I think this is amazing, and like that, we have other product we can relate with Onpassive, like OConnect. I just told the name OConnect. This is better than Zoom, and first time you will see 8K quality. Normally we watch any movie HD, but it start from 4K. 3 times multiply than HD. We started from 4K quality, and we're going to 8K quality. 8K quality is not even using Netflix. Video quality. I'm talking about video quality and many things. And we have a Academy. There will be many courses. They started from doctorate level. No need to go abroad. No need to go abroad. No need to use spend expense. You can use Academy. You will get degree and certificate like Harvard or something. So
Right.
it's huge. Onpassive is huge. Even I hope, inshallah, will do. I know you have a short time, and we'll do another talk show. Other talk shows, like we have many doctors here, Dr. Bill Williams, and many people. I hope you will come again on my show, and
Inshallah.
yeah,
Yes,
inshallah,
I will.
and
I will.
we'll discuss the other matters, and we'll discuss about these products. So,
Okay.
thank you very much, Dr. Arshad, to join this
Thank you.
session. Thank you very much.
Thank you
I
to
wanna,
both of you. Thank
Waseem,
you
I
to
want
both
to
of
add,
Yes,
sorry, I want to add something to all connect with,
yes,
because Dr. Arshad is a pediatric. He's a pediatric doctor. So with O Connect, it is so fun friendly. So when you introduce O Connect to the children, it will just stimulate their mind and stimulate how they operate. Because when we stimulate our mind, we operate better. Because sometimes what we
Sure.
have to think about our healing is really from our mind.
Sure, I will do. I will do.
Yes. So O Connect is very fun friendly and
Okay.
family
Okay.
friendly.
thank you.
That's
Thank
true.
you very much.
That's
Thank you very much. Thank you,
thank you very
Grandma
much.
Willis-Brown. Thank you, Dr. Muhammad Arshad. We'll see you next any show. Thank you very much.
Inshallah.
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 And
Allah
Thank
Salah.
Hafiz.
you. Thank